The causes of suicidal behavior are not fully understood. However, this behavior clearly results from the complex interaction of many factors. Although many risk factors have been identified, they mostly do not account for why people try to end their lives. In this review, we describe key recent developments in theoretical, clinical, and empirical psychological science about the emergence of suicidal thoughts and behaviors, and emphasize the central importance of psychological factors, personality and individual differences, cognitive factors, social aspects, and negative life. Events are key contributors to suicidal behavior. Most people struggling with suicidal thoughts and behaviors do not receive treatment. Some evidence suggests that different forms of cognitive and behavioral therapies can reduce the risk of suicide, but hardly any evidence about factors that protect against suicide is available. The development of innovative psychological and psychosocial treatments needs urgent attention. The reasons behind suicidal behavior are still not fully understood. What is clear, however, is that it does not arise from a single cause, but from a complex interaction of many factors. While numerous risk factors have been identified, they often fail to explain why some people reach a point where they attempt to end their lives. Recent advances in psychological science across theory, clinical practice, and empirical research have begun to shed light on how suicidal thoughts and behaviors develop. These findings highlight the central role of psychological factors, differences in personality, patterns of thinking, social experiences, and exposure to negative life events all play a significant role in increasing vulnerability. Despite this, most individuals who struggle with suicidal thoughts or behaviors never receive professional support or treatment. There is some evidence that cognitive and behavioral therapies can reduce the risk of repeated suicide attempts. However, there is still very limited understanding of the factors that protect people from suicide in the first place. For this reason, the development of innovative psychological and psychosocial treatments is urgently needed, along with greater attention to prevention and access to care.